we were speaking about AMR, and one thing we are yet to discuss is AMR itself. What can we do? What can we actually do to prevent AMR? Professor T, you're muted. We still can't hear you.
Now you can
Yeah,
hear me.
yeah, we can.
Too many buttons. Right. So that's a big question. But Varun has alluded already, and we spoke about drugs. Yes. So obviously we need n- drugs to counterbalance the AMR effects. But I think in the first place, it is. What do we do about AMR? The best is if we don't need treatment at all. So preventing infections, I think that's the most important. If you don't need to treat anyone, and again, I'm saying humans, animals, plants, if you don't need to treat, then we don't bring these agents into the environment. We don't expose the pathogens, the bacteria to these antibiotics, then they don't develop resistance. That is really the core thing. So reducing the rates of infection. And so that's vaccinations, for example, really, really important. But in general, infection prevention and control, hand washing. So important. Yeah, hand washing already is a good tool against AMR. Just keep that in mind. The other thing is if we have to use antibiotics because a patient is so sick that they need to be treated, we should use antibiotics, the right antibiotics for the right patient at the right time for the right duration. For that, we need to have tools to determine that. And you won't be surprised that I will say we need more diagnostics. We need better diagnostics. We need diagnostics which can be done anywhere where they are needed. So, for example, in the doctor's office, when you go and see your general practitioner, very unlikely that they do a test on you and then choose an antibiotic. Most of the times they don't have those available. And so they take maybe a sample from you. You may have given blood or you may have given urine at your general practitioner, and then they send them away. And then days after they have been sent away, you receive a result. Now this is much too late to inform the decision making for the practitioner, the prescriber, the doctor. So we need to have more rapid tests so they can be done while the patient sees a doctor or even at home. You can make a test which indicates what's wrong with you. So that's what is called point of care tests. We need more rapid point of care tests to be done where the decision is made very quickly. And most of the antibiotics are prescribed in primary care. So this is where our first interaction is with the healthcare system. Most of them are for respiratory tract infections, urinary tract infections, wound infections. All these areas are very, very important. So guidance on if an antibiotic is needed and then which one to choose. And which one to choose, you need to have the right antibiotics, of course. And this is what we spoke just before. You spoke before, Varun alluded to, and Manish has a lot of experience in developing the right new antibiotics. And so that's, I think, in a nutshell, what we should do about AMR. But there are many other aspects, but it's reducing the amount of antibiotics we use, yeah, reduction of antibiotic consumption, and then the more appropriate use of antibiotics. Now you're muted. Good.
Sorry about that. Yeah. So I think I have to come back to that because I have a little bit of question in there about antibiotic usage. But before then, Manish, this is a question that I am quite inquisitive about. It's about the AMR prioritization because I have noticed that, in fact, when trying to compile and looking at patient videos, and I saw that someone actually suffered from HIV and still suffering from AMR at the same time because the drugs the person was using to combat stopped working. So it's more about understanding why AMR is often deprioritized compared to other diseases like HIV, tuberculosis, or malaria, despite it having actually an higher mortality impact. So can you shed a little more light on that?
Yeah, I agree that AMR is frequently under prioritized compared to HIV, TB, or malaria. I mean, even though it now causes more deaths globally, this is because it lacks first is political visibility, then there is lack of emotional resonance, and other part is the program's clarity itself is very 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 fuzzy because HIV, TB, and all have been there for long. Here, AMR, it is everywhere but invisible, right? It is costly but not glamorous for anybody to invest into it. And it has very noisy signs in the sense the data is very incoherent across the world. Everybody is finding different things, though the larger messaging is correct, but the way it is very fuzzy. But in the society it is very quiet. Nobody talks about it in the society. It's only the scientific community we talk about it. So HIV, TB, and malaria, they have built for themselves very strong identities. There are movements around it, there are funding around it. But AMR lacks all of this. And that is exactly where new leaders, especially the younger generations and also the emerging economies, are critical to reposition AMR as a top tier global health priority. Otherwise, everybody talks about AMR, but there is no single program that owns AMR at all, right? Because it is a cross-cutting phenomenon affecting all infections, UTI, pneumonia, sepsis. But HIV, it's defined with identifiable pathogens, clear clinical pathways, and measurable outcomes. That is what is very confusing for people to focus on it. And this HIV had a very powerful global movement. Everybody from civil society to champions, everybody talked about it. Malaria, TB, again, strong advocacy exists. Survivor groups are there. Clear funding channels exist. But for AMR, there is no recognizable patient identity. People die because of sepsis, pneumonia, but they never say people die of AMR. So this messaging is actually very confusing. So there is very weak emotional resilience. That this is the very weak emotional resonance that leads to low public pressure. And when there is low public pressure on governments, obviously there is less focus on it. And again, AMR deaths are very invisible deaths because they happen in ICUs among neonates, elderly, cancer patients, and death certificates rarely mention antimicrobial resistance. They instead mention septic shock, pneumonia, organ failure. So there is nobody pinpointing it. So other point is, all this is because lack of diagnostic confirmation hides the scale of problem which is existing right now. So underreporting is directly proportional to underestimation by policymakers. For them, they look at data. And next point is, HIV is the communication. For HIV, you can always tell, use condoms, take tests, take ARTs. Malaria, use mosquito nets, eliminate mosquitoes. TB, we say screen, we got ARTs, etc. But AMR, we have so many messaging: stop misuse of antibiotics, strengthen the diagnostic labs, fix sewage system, reduce pollution, improve farming, invest in new drugs. Like the chain goes on and on. So AMR actually demands a multi-sectoral change, making and that is what is making it hard to create simple advocacy messages. And that is where we need to come up with how to bring in high political attention towards this, to have this communication complexity which is existing in the whole system. I mean, I can go on talking about it for a long time. Of course, these are very complex things. Yes.
Yeah, and I actually noticed that a lot of things that it's sort of like on a global scene that we need to change, and this actually boils down to you, Francesca, and your work in policy advocacy as regards the AMR challenge. So, generally, Dr. Manish mentioned a couple of things about the global view of AMR in relation to other diseases as sort of like a challenge, and being that people actually see HIV, TB, malaria as bigger diseases because of the global attention that has been attributed to all of this. So, in terms of how can we make policymakers see the AMR challenge? How can we make them start to understand more that okay, there is a challenge, there is an issue in here as regards AMR, and actually even policy making or making it just better in the global view, with the global eye about this thing, and basically your work about probably things that you've been trying to do under or behind the scenes as regards how we can actually increase the eye or the global eye, global view on AMR.
Yeah, so that's a very complex question for which I don't have an answer. And I think if we had the answer, probably we would have already solved the problem. Because when you get into the policy making space, so first of all, as Manish was saying, it's a very complex issue. It's not only one system, but it's multiple systems. So like if you look at HIV or malaria, I mean, malaria is slightly different because also you have the mosquito and you have to do the mosquito control and not only cure the disease in people. But HIV is like simple. You just do that in people. And so the messaging becomes very clear, and setting priorities within governments, it becomes very clear because what you need the prevention, you need the tests, and then you need the treatment. Okay. Which is similar for AMR, but you have to do that in many different systems. So you have to do that in humans, you have to do that in animals, and you have to do that in agriculture, and you have to do that in the environment. And so AMR, so when you go into government, AMR is not the only public health issue that they have. They have many others. And so how do you prioritize AMR? So there are a couple of things that have happened. So initially, when we started talking about AMR, AMR was framed mostly as a technical issue, as a scientific issue. And so not much movement happened. And now the narrative has slightly changed. So AMR is not just a scientific issue, but it becomes an economic problem. And that has changed slightly the way policy makers have seen AMR. And this is because they've started seeing that it's not only affecting like the science world as such, but could have potentially huge effect on economies, on country economies. And so it's something that finally needs attention and needs something happening. We need actions to be taken, to be implemented on that side. Another thing, going back on the science, and I think what is also contributing to change in the narrative is working and implementing interventions in countries that are fit for purpose and they work within the context. So one thing is to implement one size fits all. Another thing is to actually work on AMR in different countries to create solutions that work in those countries. And so the policymakers, they see that with a different eye, because it's not something that they just need to do because they've been told that they need to do that. It's something that they're working on together with international agencies, international bodies, public health institutes. And so they've finally seen that, okay, this intervention is working for us and it's been very effective. And also it's been very economically effective because we are saving money. So if we do prevention in humans, we're saving this much in treating potentially very complicated infection at the hospital level. If you're doing intervention in agriculture, it's saving us this much. So if you're doing intervention in livestock, we are reducing infections in animals. The animals are happier. They gain weight, and so that's a win-win situation, and they are more likely to adopt that change. So I don't know if it's clear what I'm trying to explain. There are different things that have happened in recent years that are moving the needle um, towards governments and policymakers being more responsive.
Okay, okay. Yeah, so still speaking about the public eye and making the public understand the issues with AMR. So Manish, this is coming back to a couple of things that you mentioned about, okay, there are methods, specific methods to actually prevent known diseases like malaria. Oh, use a mosquito net. HIV, use a condom, and things like this. Don't share clippers and things like this. So, for the general public, how can we actually understand the issues with antibiotic use and prescription, and how it personally relates or how it relates to the AMR issue?
Yeah. Uh, Thank you for that. Antibiotics are very powerful, they're very precious, and they're perishable as well. So we will have to use them only when truly needed, exactly as prescribed, and never without expert guidance. Many a times we do it on our own because, first thing, we have to remember antibiotics don't work for most common infections because mostly they are caused by viruses. And antibiotics kill bacteria, not viruses, right? And as feeling better doesn't mean the infection is gone. People think, okay, I'm feeling better, so I stop taking the antibiotics. That is very, very bad. Our symptoms may improve before the bacteria are completely eliminated. So stopping early leaves behind the bacteria to evolve into drug-resistant bacteria. So we should never stop the taking the antibiotics midway. And then, not every fever needs an antibiotic. Fever is, in fact, body's alarm system, but not a diagnosis. People confuse it. So fever doesn't require any antibiotics. There are methods which the clinician would say how you control fever. And other thing many people do is self-medication. They take leftover antibiotics from family members. It's dangerous. Or buy from pharmacies without prescription. Go and convince them that you got a symptom and buy something. Or take someone else's prescription. Why should I go and pay the clinician? I'll have similar symptoms. I'll copy your prescription. And all these things lead to the reverse of what Till mentioned: wrong antibiotic, wrong dose for wrong duration. So side effects will be very different, and that could mask some serious illness that may be inside and build up resistance. So antibiotics are always precision oriented, not a guesswork. And then other messaging for the public is, antibiotics are a limited exhaustible resource. We don't have them unlimited. Unlike painkillers or vitamins, you can go on adding. Antibiotics lose power. Painkillers and vitamins may not lose, but antibiotics, they will lose power over the microbes if they are used, if they're misused. So every person has a role in protecting the antibiotics effectiveness for a long period of time. Otherwise, the clinician says you don't need antibiotics because they say they're protecting you. But we say, no, 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 we need antibiotic. But we have to remember also when we take antibiotics indiscriminately, it is going to cause for some allergic reactions. It can affect the gut microbiome damage. It can damage it, right? It can increase resistances. And going on further, it can become ineffective when a person genuinely has an infection. Finally, don't think that broad spectrum antibiotics are stronger antibiotics. People say, I want a strong antibiotic. They think stronger antibiotic means faster cure. No, stronger antibiotic is specific with the impact it has on the bacteria, right? And these broad spectrum antibiotics are reserved for serious infections where nothing is working. When you use such a antibiotic, that will kill our good bacteria, because human body is made up of 100 trillion cells of if it is microbes, only around 30 trillion cells are made up of human cells. So we are majority of our body composes by number of cells is microbes, and they are good, they're helping us, and they will start dying. So using big guns for mild infections makes all the antibiotics useless when they you truly need them.
Yeah, yeah, I think it's a conversation that should be recurring. The issue of self-medication, because it is quite prominent basically everywhere. I mean, I've had instances even in my personal household where, oh, I have a slight headache, and you're like, oh, you use this, it's worked for you. Yeah, just give me. And you're probably having another issue where you actually need to like do tests and stuff like that. So it's actually also important that we actually speak a little bit about self-medication, and also about the AMR issue. And I know Francesca spoke about it and Manish also spoke about it, but still, I also love you to speak specifically about this issue. Because a lot of times we'll be speaking about AMR affecting us as humans, because yes, we are the number one creatures in the world, and it's important for us to preserve ourselves, but it's also important for us to preserve our environment. The circle of life is important, and preserving the animals, the agricultural products, and stuff like that, which are actually important in the balance of life. So speaking more about the AMR challenge as regards the agricultural scene, the environmental scene, what is your take on how AMR actually affects our environment and agriculture? Is it something that we need to throw more light on, that we need to actually pinpoint and see it as a big issue, or it is a minor issue that we can actually take with levity?
Oh, yeah. So if I understand correctly, you are asking about One Health or planetary health. So it's a question of the holistic aspect of how we are living. Now, people, we tend to think that people care about the environment, but maybe they don't care enough. Otherwise, we wouldn't have other discussions. But the issue is that with AMR, bacteria are everywhere, and they're needed everywhere. So we need the bacteria in the ecosystem out there in the environment to produce agricultural crops. So the soil is a living thing, is not dead and just growing things. There are bacteria in there. We have the livestock animals which we eat, or we eat their products. They are there, they are living there, they're eating what is growing out there. So we are critically dependent on a functioning environment to feed us and for our healthy living. We have had COVID. There's big debate where this was coming from and so on. So a lot is about zoonoses. So interaction, getting ill by illnesses which are out there in the environment. So that shows us that there is transmission. Infections move from the environment to people and vice versa, or from one sector to the other. So there is exchange, and this exchange is something which we need to keep in mind. So we need a healthy ecosystem to feed us so we can live, but there's a lot of exchange as well. So something which is happening out there, if you want, in the environment or with wild animals, with birds, for example. There's a lot of knowledge now about seagulls, for example. Seagulls being involved in the transmission of bacteria and resistance. There is exchange, and so we need to keep that in mind. So if we use, and another thing is that if I, as a person, use an antibiotic, what goes in also comes out. And so we are producing, we are, by consuming antibiotics, we are releasing them or their degradation products into the environment. And it has impact there. So there's nothing without impact. So it has impact on the environment. The other one is the bacteria, which I make resistance by, or by my action or by the action of the prescriber, they become resistant in me, will in fact affect my family. It affects my neighbors because there's transmission of bacteria between people. Again, COVID has shown how things spread between people. So it's a social challenge that if I misbehave, it affects others, and if others misbehave, it affects me as well. Misbehaving meaning inappropriate use of antibiotics and everything which was said before. For example, self-medication. If I self-medicate wrongly, it affects my surrounding. So this is really, we need to be more responsible with the way we use antibiotics, and we need to be mindful about our environment, because for its own sake, but also because we critically depend on it. And the impacts are very quick. Yeah, so we see impacts on soil microbiome diversity. It becomes less resilient. It affects the production of food-producing animals. All there, we have challenges, and so mindfulness of the consumption and or the use of antibiotics is really key. And because it hasn't been said yet, I think for the general public, it is critical to understand that we always speak about infections, and people think about, yes, I go to the doctor because I have a cold, or maybe a urinary tract infection, but it affects also a lot of other health interventions. So if you have a cesarean, if you have some elective surgery, if you have a heart problem, if you have cancer, if you become, if you just get it by getting old and you have other morbidities, the likelihood of you getting an infection, which then cannot be treated anymore, is very high with AMR. So that affects us very, very dramatically, not just in the initial infections, but in many things which affect our health.
All right. So we are to take final takes now because we are at the end of the session. But I have a question, or there's a question for you in the chat. So can we just use a minute to answer this? And it's directed to Professor Teal and Manish, Dr. Manish. So do you ever think science can keep up with resistance? So Manish, can you give us your answer first? Do you ever think science can actually keep up with resistance in 1 minute, please?
It's a fun journey with microbes constantly because we can never solve it. Every time we find a solution, we have another challenge with the microbe poses us. So we continuously journey with it. It's a perpetual journey.
It's a perpetual journey. All right, Professor Teal, any contrary opinions?
So I think one thing first is we need to see microorganisms not always as a problem. We need to see that we depend on them. That helps us, and it's an resistance. It's a natural thing. It is happening, so we need to live with it and we need to deal with it. So that, in that sense, yes, science can keep up with if we understand it correctly. We can't think that we can eradicate resistance. This is not going to happen. There will be always resistance, but there is an opportunity. So I think what we need to do, we need to turn AMR from a threat into an opportunity for learning, for development, for really making businesses. It's a and coming together as a society. So turning AMR from a threat into an opportunity
Yeah,
would be my
yeah.
answer.
Turning AMR from a threat into an opportunity. Hope you got that blessing. Yeah, so we have come to the end of the session. I would love for um, everyone to give us like a closing statement in 20 seconds because I understand that we all have to run. So can we start with you, Professor Teal? You, in 20 seconds, do you have anything you want to say?
I would like to repeat what I just said. And we don't see microbes always as a problem. Understand what is happening there. Take care. Handle antibiotics with care. And finally, again, turn AMR from a threat into an opportunity.
Awesome,
Thank
awesome,
you.
awesome. We are quoting that and we're having that as our bio on all platforms. Yeah, Dr. Manish, in 20 seconds, anything?
Antibiotics are life saving, so treat them like gold.
Hmm.
So we just need everyday discipline, awareness, and leadership in our own circles. So I echo Till's statement as well.
Awesome, awesome. Francesca?
Yes, my message is let's keep talking about it and let's keep raising awareness. And as scientists, we need to do that. We need to go out there and keep distributing the message.
Awesome. So we need to keep distributing the message, look at AMR as an opportunity, not as a threat, and treat AMR as good. I think I got that. Yeah. So we have come to the end of the session. Thank you very much, Dr. Manish. Thank you much, Francesca. Thank you much, Professor T, for taking time out of your busy schedules for us to do this. And remember, it's a World AMR Awareness Week. So educate somebody about AMR. It's a very important issue and something that we are constantly facing. Have a great week. Have a great rest of the day. And see you at the next one. Bye, guys.
Thank you.
Thank